Well, good afternoon. We're going to do things a little bit differently today. I'm going to do the regular update briefing on conditions in the city of Detroit. But before that, I wanted to join with some outstanding scientists at the Henry Ford Health System in asking for the people of southeastern Michigan, the healthcare workers and the first responders, to consider enrolling in what is going to be a major national study. In Detroit, we don't normally take things lying down. We fight back. And the doctors at Henry Ford have been using hydroxychloroquine in treating patients on ventilators. And I know while they won't talk about enough of a study, there's certainly, in a number of cases, promising results. And they wanted to go further. The folks that are here with me, Dr. Adnan Mankara, Executive Vice President of Henry Ford, Steve Kalkanis from the Henry Ford Medical Group, and Dr. Bill O'Neill, and Mark Zervos, who we gave the day off, who's been advising us on infectious disease all along, have an idea that if you gave our healthcare workers and our first responders hydroxychloroquine doses early on, could it prevent the disease? Or if they do get the disease, could it be milder symptoms? And there's only one way to do that scientifically, and that's with a blind study. And so they have proposed to the FDA that 3,000 individuals from southeastern Michigan, first responders, cops, firefighters, bus drivers, EMTs, and healthcare workers who volunteer, if you want to volunteer to be a part of this, would come in and take a blood test. You take 8 pills a week for 8 weeks. Some will get a placebo, some will get different doses. And in a matter of 4 to 8 weeks, we will have a really good idea of whether this works. And we're going to be fighting the coronavirus for months at least to come. We need to have tools to fight back. And so I had a chance to talk to Dr. Steve Hahn after the doctors at Henry Ford had told me about this idea. I've known a number of these doctors for many, many years. Dr. Bill O'Neill, who's heading this, is famous in the medical profession for a different reason. 30 years ago, Dr. O'Neill was one of the world's pioneers in angioplasty. And his research was so meticulously done that angioplasty quickly became the standard of care in this country for many cases instead of open heart surgery. He's universally respected and is leading this. And so when Dr. O'Neill and Dr. Zervos were together saying, we believe this, I wouldn't have put my reputation on the line with the FDA director to say, I think this is a high priority, if I didn't believe in these individuals. And so they are getting close to FDA approval. They're going to start enrolling volunteers. Doesn't matter if you're from Southgate, Birmingham, Grosse Pointe, Detroit. We're looking for first responders and healthcare workers who, if the study works out, will save the lives of first responders around the world. And so I gave you the English version of this, but to start on the medical side, I'll turn it over to Dr. Adnan Mankara. Doctor?
Thank you, Mayor. Good afternoon, everyone. It is really inspiring and moving to be here with you this afternoon because we are embarking on a study that is very highly needed in the midst of this pandemic. Detroit has been a beacon of innovation. Henry Ford Health System has been part of the DNA of Detroit. And in the midst of this, the rising of this city, we got hit with our pandemic. We are a hotspot. We are committed to take care of our community and our patients. As importantly, our first responders and healthcare workers are really in harm's way. We are seeing being exposed day in, day out. Many of them, some whom you know, have tested positive. Some, unfortunately, are in the hospital because of this virus. And accordingly, when the opportunity opened to us to look at research trials to do that, my partners and colleagues, Dr. O'Neill, Dr. Steve Kalkanis, Dr. Vrzervos, jumped on that occasion because we want to save people who are exposed. We want to make sure that our healthcare workers and our first responders are protected while they are committed and dedicated to take care of us. We've done research for over 100 years at Henry Ford Hospital. We have a lot of clinical trials and we know how to run that. But this trial specifically has a special place in our heart because it really is meant to save the lives of people who are very important to all of us. The drug hydroxychloroquine is being used now for people who have the virus and have some symptoms. The study is meant to look at this drug for these people who get exposed, and we want to make sure they don't develop symptoms and don't develop the disease. And to speak more about this trial, I'm going to turn it over to my colleague and partner, Dr. Steve Kalkanis, our Chief Executive Officer and Senior Vice President for the medical group.
Thank you, Dr. Munkara, and let me add my profound thanks to the mayor and the city of Detroit for your exemplary leadership. People have asked why this trial now and why here in Detroit. Well, you know, Detroit's always been the comeback city. In the last century, we turned factories into the arsenal of democracy to win World War II, and now we're turning our healthcare system into a new front in a war against COVID-19, and we believe today we can announce a groundbreaking clinical trial that will help people around the world. This study looks at whether or not taking hydrochloroquine before you get sick will prevent you from getting COVID-19. We need this in our front lines for our Detroit police officers and EMTs, but also our healthcare workers, people in the emergency room and in our intensive care units who are day in and day out putting their lives on the line to protect our community. And despite the fact that they report every day with this risk, they do it willingly, and so we owe it to really define once and for all, does this regimen work so that we can protect the people who are putting themselves at risk? Right now, there are no proven cures, and there are no proven preventative treatments for this virus. We owe it to them to look for ways to protect them, and so I'm very pleased, and to echo what the mayor has said, we've been actively engaged with the FDA for the last several weeks, and in the last couple of days in particular, we've gotten to a point where we believe we are ready to launch. And this includes a fast-tracked approval through the Henry Ford Institutional Review Board, and we believe that we will find the gold standard way of answering this question, and that is a double-blinded, randomized controlled trial, which simply means that both the study designers and the people in the study don't know which regimen they're getting. That's the best and most scientific way to come up with an answer is whether or not this treatment works. And so I'd like to turn it over now to our world-renowned interventional cardiology colleague, Dr. Bill O'Neill, and I also want to thank our infectious disease chief, Dr. Mark Zervis. Dr. O'Neill will tell us a little bit more about how the study is designed and how patients can enroll.
Thank you, Steve, and thank you, Mayor. And the people don't know, I almost worked for you about 15 years ago. He tried hard to recruit me to come down to the DMC, but it was just this close. So
I got you a few years later now.
You did. You finally got me to work for you.
There you go.
So I'm a long-term native of the Southeast Michigan. I grew up in Ann Arbor. I went to Wayne State for med school, graduated in 1977, and have been here in this community really for 40 years. And it means a great deal to me. And we've all seen the devastation that this disease can cause. I have a brother and sister-in-law who are really ill at home right now for over 2 weeks, kind of teetering as to whether or not they're going to need to be hospitalized. So every one of us knows someone that's been taken with this illness and unfortunately people who have died. And so we decided to look at what were the available options. As soon as this virus hit China, there were reports and people were trying to figure out how to treat it. There was one interesting report that said that people that were taking this drug, hydroxychloroquine or Plaquenil, and it's a common treatment for lupus. That's a rheumatologic disease. If they were on that drug, they didn't get infected. So that was like the one first evidence. And then there was a small study in France where it was non-randomized. People sequentially got the drug and it looked like it worked. And more recently, a small randomized study in China, again, that suggests that there's some benefit. So from the scientific side, it looks promising, but not definitive. And we really, really need to know the answer whether or not this drug works or not. And as the mayor said, the only way to do this is with a placebo-controlled trial. And so one arm is going to get a sugar pill, one arm is going to get a once-a-week treatment, and one arm is going to get a daily treatment. And so it's been well thought out, and we will definitively prove whether or not this drug prevents healthcare workers, first responders, the people who are at highest risk for getting this disease, from getting this disease if they're on the drug. We are conducting it for 8 weeks. There are going to be 3,000 people enrolled. We know that it's going to be very popular, and we will try to enroll as many people as we can. The biggest impediment, honestly, has been is the availability of this drug. Everybody in the country wants it. People had a run on it, kind of like toilet paper. It was impossible to go to pharmacies to get it. There have been now some medications that have been donated to the Strategic Reserve, and through the mayor's help, and I really want to compliment and thank the mayor so much for your involvement, Mayor, and like you said, putting your reputation on the line to get us access to that, and we are very confident that we will have that. We've finished the planning phase, and we believe that early next week, Monday or Tuesday, we'll be starting open for enrollment for the trial. And what this is going to do is it's going to provide us an answer for this year, but probably more importantly for next year. This thing is coming back next fall, and when it comes back, if you're a healthcare provider or even someone that's been exposed, we think that this will tell us whether or not definitively this drug works to prevent this awful disease.
So before we take any questions, I want to make one last point. The head of the FDA, Dr. Steve Hahn, is emerging as one of this country's great leaders. The FDA normally is very slow and deliberate in approving devices and drugs, as they should be. They are moving at a speed they never have, because to not act will lead to more devastating consequences than to act quickly. At 4 o'clock today, I believe the city of Detroit will become the first city in the United States to start using the Abbott Laboratory 15-minute test. Our folks have been trained this afternoon, and we're going to start doing the 15-minute tests at 4 o'clock today. That's only possible because Dr. Hahn moved quickly on that device approval. And on this test, I talked to him a week ago about this proposal. The FDA has been talking to the scientists at Henry Ford since, and Dr. Hahn called me at 7 o'clock this morning. The speed at which they are moving is remarkable. Nobody's promising any results here. We don't know, but what you've got is some of the finest scientists in America believe this has potential, and the only way we're going to find out is to give it a try. And so at henryford.com, if you're a first responder or a healthcare worker in southeastern Michigan, you can go to their site, and if you want to volunteer, you got to be willing to have your blood drawn and take 8 pills a week for 8 weeks. And it may not work, or you might change the world. And with that, we'll take some questions.
So far, it doesn't look like we have any questions on this topic unless Andre's got any. But there are some other questions I think that'll come up more so in the second panel.
So we're gonna break this into a second session to talk about services for the city of Detroit. But does anybody have anything they want to ask these doctors? Go ahead.
Will this affect patients who are undergoing treatment for lupus?
So, go ahead.
That's a very good question.
Bill, you got to repeat the question.
Yeah, the question is, will this affect availability of this drug for people that are being treated for lupus? And the answer is that there's going to be a huge amount of the drug that is currently being manufactured. There's 3 pharmaceutical companies that are making it, and the supply, I think, will be readily available. For these trials, we're not going to be taking the medications away from the pharmacies. They're going to be coming from the Strategic Reserve or from a separate shipment that Mylan Therapeutics is going to be sending us. So people in the community don't have to worry that if they have lupus or arthritis that they're not going to be able to get their medications.
We have a question from Fox 2 wanting to know how long this trial has been in the works.
We started thinking about it 10 days ago.
Okay.
And so in 10 days, we've stood up a 3,000 patient placebo-controlled randomized trial. I mean, crisis demands that kind of speed from everybody.
And just to give you an idea, this is probably one of the fastest conceived trials that you can look at. For scientists like us who work on these things, usually this takes weeks and months of deliberation for the team to come up with this idea, put the hypothesis there on the table, develop the proposal, get the drugs, again, with the support of we could not have done it without the support of the mayor, being able to secure these drugs and moving it fast through the FDA.
Okay. And beyond the 8 pills a week, can you be more specific about the dosage of the drug?
Yeah, we're going to be giving, one group is going to get placebo, one group is going to get the drug treatment that you get for malaria prophylaxis. So if you're going to malaria-prone zone, the doctor gives you 2 of these pills every week. So you get 2 pills a week for 8 weeks. And then you get sugar pills in between. You don't know what you're getting. So that's the one dose. And the second dose is getting 2 pills to start and then 1 pill a day for 8 weeks. And that's the dose that's being used for lupus prophylaxis. So we're using safe doses that have had a long clinical track record for safety so that we're not posing any risk to the people that are in the protocol.
Is it 200 milligrams?
Yeah, 200 milligrams a day for 8 weeks.
Okay. And I think you just answered the last question that came up was there any concerns about safety or adverse effects?
Well, the drug has been approved for over 70 years. It's very commonly available, and there's tons and tons of experience both with rheumatology for rheumatoid arthritis and for lupus, but also for the treatment of malaria. So there's a very good, well-established safety protocol. That's the reason why people are actively testing it in the United States right now. There are at least 4 ongoing trials of similar nature, one at the University of Washington, one at the University of Minnesota, and one at Columbia University. So we'll be the 4th study in the country that are going to be looking at sort of the early phase of this disease.
Is anybody else testing it on a prevention basis?
There are people that are looking at for prophylaxis. So if you're a first contact, if you're living with a contact, and this is a study from the University of Washington, and the University of Minnesota is looking for healthcare providers who have been exposed. So they're known contacts. This is a little different. This is just coming in not knowing whether or not people are exposed to COVID or not.
Right, so this is the first study, if I'm understanding them, that it will be given out to folks before they have any reason to believe they have it, to be able to test what happens, right?
Right. If you're a healthcare worker next fall, we will definitively know whether or not this medication prevents you from getting ill if you're exposed to these patients.
Okay, that was the
Anything
last
else?
question.
All right, we're going to take a couple-minute break and properly sanitize this, and then we'll do the second part of this where we'll talk about the services to the people of the city of Detroit. Thank you. The deadly spread of COVID-19 through this community continues. We lost, as of noon today, 15 more of our neighbors. And you may have seen Council President Brenda Jones, who I talked to a little while ago, has now tested positive. She sounded good when I talked to her, and she wants everybody to know that she's doing well. I talked to Chief Craig a little while ago. He's still home, and he's still fighting it. But we're to the point now where we know, we all know people who have been affected by this disease. Our drive-through testing site is going to be a huge part of this strategy. People need to know whether they have this disease, and we're doing 500 to 600 tests a day. We got the numbers in from the first 2 days testing, the first 500 cases. 43% of the people we tested positive. That's a pretty troubling number. I talked to Dr. Caldoun last night. The state's numbers overall since the start have been running about 25% positive. And so we don't know yet whether the sickest people were the first 500 who came through, or whether this disease has spread so far that 43% of the folks being tested have it. But all of these numbers continue to go in a more difficult direction. It is critical that every single Detroiter have access to the tests. And we continue to run the only major testing center in Michigan because I'm committed to that. I've had folks in the last couple of days tell me I can't get a prescription. And it's not just the fairgrounds. In the state of Michigan, the state will not let you have a test without a prescription. That's a state mandate. But there is no place in Michigan that's easier to get a prescription than in the city of Detroit. We now have, through Director Fair's efforts, 30 doctors' offices and clinics in the city of Detroit taking new patients today. They're on our website at detroitmi.gov. 2/3 of them have promised to take care of everybody, regardless of insurance and regardless of ability to pay. And so if you hear somebody saying, I need a test but I can't get a prescription, please help them. Show them the website. Make a phone call to one of these physician offices. I think if you have symptoms, I believe the prescriptions will be available. The other piece that we have to solve is transportation, because right now, the only folks getting tested are people who have cars, and that's the way we had to start it. And so I have a huge team working on this, and I expect by tomorrow that we will have transportation for any Detroiter that gets a prescription and does not have a car. We are going to arrange transportation to the testing site so that you can get tested. We'll be announcing the details on that at 3 o'clock tomorrow. You'll be able to make appointments on Saturday and start getting rides to the testing sites by Monday. But I am not going to stop until everyone in this city who needs a test can get a test. As far as our first responders, we had very good news at the Detroit Police Department yesterday. Only 13 officers newly quarantined, far and away the lowest number we've had in more than 2 weeks. Dr. Dunn's program that he put in a week ago with the Detroit Police Department, with the temperatures and the like, I believe have turned the corner. So the numbers for the day overall in the city are this. We have 106 employees of the Detroit Police Department who have tested positive for COVID-19. 106 Detroit Police Department employees, 24 Detroit Fire Department employees, and 8 DDOT employees have tested positive. From quarantine, we have now 524 police officers on quarantine, another 123 civilians, but again, with Dr. Dunn's assistance, I'm very pleased with the fact 141 officers have returned to work and 98 more are in process. We've got the kind of rigorous medical care that we should have so that those who are sick are getting good treatment and those who are healthy are coming back to work. We've got 126 employees of the Detroit Fire Department currently quarantined and 133 employees of DDOT currently quarantined. That is going to start to change dramatically when we start using the 5 Abbott lab machines this evening. And we will be running them tomorrow and through the weekend. They will get results in 15 minutes. If these 5 Abbott lab machines work as promised, and we're going to be the first ones to find out, we could potentially return large numbers of employees who are quarantined back to work because they're healthy, and those who are tested positive, we will make sure they get the right care. This is the game changer we have been waiting for. Too many times, our officers, our firefighters, our bus drivers get tested and are waiting 5 days, 7 days, 8 days for return. You don't know where you stand, and you don't know if you're infecting people or if you're quarantined unnecessarily. This is going to be a great thing, and I know Dr. Dunn in particular, who has been working 18 hours a day to get our first responders back to work, is looking forward to that. Of the 15 people we lost in the last day or so, 3 of them hit really close to home. A Detroit Police Department chaplain, Valerie Parks, a 5-year veteran of the Detroit Police Department in the 8th Precinct. She's known to everybody as somebody who would hug you when you were down. A terrible loss to this community. One of our building and safety inspectors, Jeremiah Brooks, a 3-year employee, person with a heart of gold. He would take on any assignment nights and weekends to get an inspection so businesses could get open. He never turned down an assignment. And it was a terrible loss to lose Mr. Brooks. And then one that I think should touch everybody in the city of Detroit and should touch everybody in the country. Jason Hargrove, a bus driver, who knew the risks, was vocal about the risks, went to work anyway. On March 17th, the DDOT drivers stopped working because they didn't feel that enough was being done to protect their health. I dropped the rest of my schedule, and I spent the day with them both at the Shoemaker and the Gilbert terminals with those drivers. And they told me stories of passengers getting on the bus and coughing and sneezing as they were putting money in the fare box, as well as other issues. And as a result of that, I ordered the front doors closed. I ordered that we stop collecting fares and that people board and deboard in the back to protect our drivers. I know a number of other cities have not done that. They said they couldn't afford to lose the revenue. I just didn't think we should be putting our drivers at risk. But if you haven't seen Jason Hargrove's post on social media and Facebook, everybody in Detroit and everybody in America should watch it because he was infected before we closed the front doors. And he tells the story of a passenger getting on the bus and coughing on him. And some of his language is graphic, but I don't know how you can watch it and not tear up. He knew his life was being put in jeopardy, even though he was going to work for the citizens of Detroit every day, by somebody who just didn't care, somebody who didn't take this seriously, and now he's gone. And every time I see images of a group of people still clustering in this city or this country, I think about the Jason Hargroves on the buses, I think about the cops, I think about the nurses and the doctors in the hospitals who are going to work for you every single day. And for you not to honor the social distancing request, you're putting really good people like Jason Hargrove's lives on the line. I hope the people of the city and the people of this country will watch his video and listen to his words because it's the message this country needs to hear. Dr. Dunn, I thought, was the hardest working man in Detroit. He started off as the medical director for the Detroit Fire Department, and when COVID-19 started to spread through the Detroit Police Department, I went to him and said, how about you take the police too? And 10 days or so ago, we put in new implementations at the police departments. Our officers are wearing masks in the precincts. We've got distancing. We're following really good protocols. When you are off sick, we are calling and checking on your symptoms every day. If we don't reach you for 2 days, we go out to your house to see what's going on. And we've added other initiatives. Today, Dr. Dunn is now the medical director for DDOT. And we already started last week with a number of these measures to protect our bus drivers. We are going to ramp them up with every bit of vigor. We are now going to put systems in place that when bus drivers show up for work, we're going to take your temperature before you come in the door. If your temperature's too high, we're sending you home. If you're sick, we're going to make sure you're at the right doctor. We're going to make sure we're checking on you every day. And the hotel option that the Greektown Casino has been so gracious to provide for police officers and firefighters who are going home to family members who are elderly or have medical issues and they're afraid to take the disease home. As of today, we are extending the hotel services to our DDOT drivers. If you've got somebody in your household that is vulnerable because of health reasons or a newborn baby or the like, we are going to have hotel rooms available for our DDOT drivers, just like our cops and firefighters, to be able to stay so you don't bring it home to your family. And with that, I can never express the gratitude I have for Dr. Dunn, but he has stepped up now and is going to provide the same kind of great support to DDOT. And Dr. Dunn is going to lay out a 6-point plan to protect all the employees in that department. Dr. Dunn?
Thank you, Mayor. When I heard about the tragedy at DDOT, I thought of my own initial experiences as a student in Detroit. My wife and I would ride the bus, and that was my first experience with the DDOT drivers, who were always great, and I definitely saw them not being treated well sometimes by people getting on the bus, and it was just tragic to hear this story and to see the posts regarding that. And when he asked me about this, I said, I want to do anything I can to protect our folks who are out there, because they are the only way that people get around a lot of the time, and it was the way that I got around for a while myself. So we want to take the lessons that we've learned with the police department and the fire department that we've already been applying and apply them even more rigorously. So number one, we want to stay focused on wellness. Anytime that someone is ill, they can activate the COVID team that we have through the city of Detroit to get out, do an evaluation, and help guide any ongoing care and initial testing. We also want to make sure we're tracking very carefully high-risk exposures and other exposures in the community. As the mayor mentioned, we have masks, and we want to be sure that people are using them right, re-educate everybody on the appropriate use of personal protective equipment, because it is very important, wearing that mask, doing good hand hygiene. I see people being better about this all the time, but it is absolutely vital. We're going to have daily symptom checks for everyone. That has been something that has been well proven with our healthcare workers and police departments, to catch any symptoms early, to ask people. Many people just feel like they can tough it out, and when you directly ask them, they actually are having some symptoms. So that's a really important piece of that. And probably the most important thing that truly is a game changer, as the mayor mentioned, is the ability to have access to rapid testing. Denise Fair, who's sitting next to me, has made a heroic effort to ramp up so we have rapid test results available for all of our employees that need them. We've had great partnership with other testing centers, but that ability to get a test quickly was something that just didn't exist for us until now. So someone who shows up sick, I can get them tested, I can find out if it's COVID, if it's something else. In addition, for someone who needs to get back to work, who had symptoms, maybe they tested positive, they're better, they're doing well, I can retest them to be sure that they're negative and get them back to work safely. There was a significant delay in our test results through no fault of anyone's. That's just what was available. So now that we have that, that is something we're deploying aggressively over the next couple of days to get everybody who needs a test tested and get a result. The option for housing is very important. That's the next point of the plan. There are people that do not have a situation where they could be quarantined or isolated, and there are other people who are concerned about bringing disease home because of family members who have significant medical concerns or are immunocompromised. And the fact that a whole group of people have stepped up to make this housing available is essential to help prevent the spread of disease. And the next is using our healthcare worker return to work lessons that we've learned in our hospitals, at the fire department, and that we've been applying with the police to get people back to work safely and effectively and make sure that everybody is comfortable with the safety of that process. And we're working with our occupational medicine providers and healthcare partners on that, and that is something that we'll also be applying to the Detroit Department of Transportation.
Denise Fair, who's done a great job at getting the 50-minute test site up and running, but she always has the worst assignment of the day, which is to talk about the people who are being affected in this community. I'll turn it over to Ms. Fair.
Thank you, Mayor. I'd like to begin a little bit different than how I usually provide a briefing. I just want to say thank you. Thank you to all of the first responders. Thank you to the grocery clerks, the bus drivers, the volunteers, all of those who are working day in and working day and night to ensure our safety and the access to the things that we need to care for ourselves and our families during this challenging time. I'd also like to thank those who've been heeding the mayor's, the governor's call to stay at home. Thank you to the residents who are washing their hands, those who are disinfecting surfaces. I encourage you to continue those efforts. And again, thank you. So as of today, there are 2,860 confirmed COVID-19 cases in Detroit and 97 confirmed deaths. This is 377 more cases and 15 more deaths than just yesterday. As I stated yesterday, we are going to see several more cases because we are testing more. And this is a good thing because, again, we are testing. The age range of those that are affected by COVID-19 are all across the board, and it spans the east side, the west side, southwest Detroit, all over the city. No one is immune, and I'm going to say that again to make sure you hear me when I say no one is immune. By now, we all know of someone who has been affected by COVID-19. Maybe it's a close friend or it's a family member who has been impacted by the virus. So if you are still out and about congregating, let's be more responsible so that you are not placing your family and your friends or elderly in harm's way. So here's what I'm doing. I am a daughter of 2 seniors whom I adore, and I am distancing myself for their safety. And as I've shared before, I really believe in transparency and telling Detroiters the truth based upon what I know. The next several weeks are going to be challenging. I can tell you without a doubt it's going to get worse before it gets better. However, we are strong. Detroiters really are strong. We will continue to have the faith and to work together to protect ourselves and each other. We've shown time and time again our grit in times of adversity, but it is not lost on me that this may be harder for some than others. So if you or your loved one are feeling overwhelmed, you have anxiety, sadness about COVID-19, please speak to someone who can help you and your mental well-being. The health department, we are here to answer all of your questions 24/7. Call us at 313-876-4000 or send us an email, Detroit, the DHG outbreak at detroitmi.gov. Let's continue to work together to help slow the spread of COVID-19, and please stay home and stay safe. And with that, I'll turn it over to the mayor.
Any questions? Go ahead. Why don't you use the microphone so they can hear you?
Mr. Mayor, any reaction to Governor Whitmer's declaration today regarding K-12 students and how that will affect the services that the city of Detroit is providing, particularly distribution of food and the like?
Right. The governor did what she had to do, and the city of Detroit will continue to run the 6 food distribution sites. We will continue to deliver 40,000 meals a week to parents of children, and we're now starting to analyze what do we do with folks who may be shut in, and there's a number of good programs out there, but we are now starting to look at whether we need to broaden that. This is a hard thing to talk about. You can always look back and say you should have done this earlier, you should have done this earlier. I think about March 17th when the drivers shut down. I went into those 2 terminals and spent time with those bus drivers and mechanics, and I wasn't wearing a mask. I was in a group of people. I wouldn't dream of going into a group now without a mask. And the governor has been doing the right thing. She shut down the schools for a while, and then she made the decision that she had to make. We have got to protect the lives. And this is going to be hard for a while. It's going to be hard for weeks. It might be hard for months. But it's certainly going to be hard for weeks. And the governor, I think, has just shown great leadership, and I completely support what she's doing.
Mayor, FEMA continues to stand up the TCF Center as an alternative care site for treating nearly 1,000 patients, perhaps. I know earlier this week you said that you don't believe that they will be able to have the medical staff needed to treat maybe nearly as that many because doctors and nurses may be quarantined themselves here in the area. Do you still stand by those comments?
No, what I said was it is easier to get space than it is to staff. That's true every place. I used to run hospitals. It is a whole lot easier to get a floor and put the beds and the equipment in than it is to recruit the caregivers. But they're doing it in New York, and a couple things have to happen. One is going to have to be these speedy tests so that we can get the healthy workers back in a half an hour, not 14 days later. Second, they're seeing this happen in New York. A lot of retired healthcare workers are showing enormous courage and coming back to work. And so Dr. Jenny Addis has been leading this on behalf of the emergency response team, somebody I worked for years with at DMC. I sat yesterday with the Army Corps of Engineers. It's an extremely well-conceived plan, and I don't know if the governor has announced yet the head of the field hospital, but is somebody I work closely with who is just outstanding. The right leadership teams are being put in place, and all of the hospitals are going to pitch in. But we are going to need, I know the governor's going to talk about this, we're going to need retired nurses, retired doctors, retired therapists. We're going to need folks to come back out of retirement and pitch in and help, because you can't just open 1,000 new beds with the same number of staff. But I'm very confident that the governor is on top of this, and I'm just very pleased with the leadership team she's put in place of this field hospital. Any other questions?
Yes, I have a couple more questions from reporters who are not here with us. Give me just 1 second. As it relates to the video that the bus driver posted and his concerns, is the city considering any action against people who act recklessly and who are not taking the precautions?
So I have our law department looking at that right now. I hadn't wanted us to take a heavy hand out of the gate. I've seen that New York has now shut down all their public parks. In our case, we've had a few parks where people were continuing to gather and play basketball. It was, the police said, it'd be easier if you took the basketball backboards down than force us to keep dealing with groups. And so we strategically started to do that. The police have ticketed in some cases, but given the tragedies we're seeing, the great majority of people in the city have been great. It doesn't take a big percentage to ignore this to allow this virus to continue to spread. And so the law department has given us a range of choices. I'm talking with Assistant Chief White about what interventions the police should do, and our strategy on that is probably going to continue to get stronger, but I hope we don't need to. The police have enough else to do right now to not be having to chase people out of parks. I hope people would just respect the wishes and respect your neighbors who are going to work for you every day.
Also, in light of the situation with the bus driver and his passing, is the city considering any further restrictions on bus service or stopping bus service?
No, I think, like so many other things, I wish we would have known so many things earlier. I wish we had practiced social distancing and the temperature checks on the police department 3 weeks earlier than we did. I wish we had shut down the front doors of the buses 3 weeks earlier than they did. I'm sure the governor wishes there are things she would have done earlier than she did. I think we have the right set of policies in place now, but we're learning as we go, and this particular bus driver, Mr. Hargrove, he posted that the incident he talked about was before we ordered the doors shut and stopped collecting the fare boxes. And it's something that I'm going to think about for a long time.
Some clarification on the 15-minute testing that's being done. will that help individuals who are currently in quarantine, first responders, et cetera, get out faster, or will it just allow folks to return to work quicker once they've been tested?
No, it's both. So here's what's going to happen, and Dr. Dunn is the one who's driving this. Doctor, why don't I turn that over to you as to how you're going to use the 15-minute testing?
Sure. So we have a number of different people that we are in that kind of conundrum of needing test results. So that includes people who we already knew were positive, got better, and we want a negative test result to get them back to work. So that's one group that's very, very important. These are people feeling good, ready to get back to work. I had a firefighter yesterday who'd been better for a few days, had a test, and is waiting and waiting and waiting for results. So that's something that we'll be able to quickly do. The other group of people, of course, are people who developed any kind of symptoms anywhere in there, whether they were in quarantine, whether they just show up one day and we do the screening and they're sick. That's a person we really want to know, is this COVID or not COVID? Because there are certainly a lot of other things making people sick in a typical April and March of the year. I think all of us have experienced that in the past. So sorting that out helps us make sure people get appropriate care for whatever's making them ill, and helps us get them back to work much more promptly.
Okay, and last question, Mr. Mayor. I think yesterday you'd mentioned that you were speaking with U.S. Conference of Mayors soon, and wanted to know if you might expand on what you might talk about, how much COVID will be a part of the conversation, what you might say.
So I've been asked to speak to the mayors in a national phone call tomorrow afternoon, and I'm going to tell them what I wish somebody had told me 4 or 5 weeks ago, because there's a lot of areas of this country that are 4 or 5 weeks behind us. And I'm going to talk about the need to protect your police officers, the need to protect your bus drivers, the need to go to social distancing early. I'm going to talk about what I've learned. I spent half my day on the phone with people around the world lining up masks and gowns and test kits. I've never experienced anything like this in my life, and I'm going to share the things I wish somebody had told me 4 weeks ago. That's what I'm going to do tomorrow. All right, thank you all very much.